Today we're talking all about acupuncture and not in the way that you think. Today we're talking about the science behind acupuncture and what we now know from research about acupuncture and its effects on the body. While acupuncture is an ancient medicine, research has increased 100-fold as integrative medicine jumps into the forefront of modern medicine. So while I could talk about acupuncture via the East Asian medicine descriptions, I think it's more important to look at the research and see what it says. Every year, we are finding more conditions acupuncture is effective at treating, and every year we are learning more about why. Most of the research has been done in animal models and in humans with pretty limited research specific to horses. However, there's a lot we can take from the current research and apply to our horses. A little later in this podcast, I will talk about firsthand knowledge I have from treating top sport horses with acupuncture for the past 20 years. To start this topic off, let's talk about the conditions where research has shown acupuncture has a positive effect. They include, number one, is pain. And this can be both chronic pain and acute pain, including post-operative pain. Treating pain is especially effective on musculoskeletal pain and myofascial pain. Acupuncture is used regularly to influence the fascial lines and dysfunctions along them. Pain also could be from osteo and rheumatoid arthritis. And of course, back pain is number one on the list. The second thing on the list that I want to talk about is fatigue. So low energy, not quite feeling right. And this actually is really helped with acupuncture and honestly accompanies many chronic diseases. The third on the list is immune modulation, which basically means it balances the immune system. So if it's overactive, acupuncture helps bring it back down. If it's underactive, acupuncture helps boost the system. This is why acupuncture can help in autoimmune diseases, but also help in fighting off an infection. Fourth on the list is hormone balancing. This can be related to neurotransmitters, the HPA axis, as well as for gynecological and fertility issues. Number 5 on the list is metabolic disease, and that's actually a really large category with many diseases included. And number 6 on the list is digestive problems, including hard to treat things like IBS. Basically, acupuncture helps with the regulation of the entire digestive tract. And in East Asian medicine, this is a focus. This is really important because just like we think of in Western medicine, East Asian medicine thinks of the digestive system and its functioning to be a foundation of health. So other conditions listed in this research where acupuncture had a moderately positive effect, meaning it showed some improvement, but the improvement wasn't as large in that list I just gave you, was things like cardiovascular disease or pulmonary disease, including things like asthma and COPD. Of course, kidney disease and urologic disease, neurologic diseases, neuropathies, and even stroke and dementia is on that list, as is things like allergies, other gastrointestinal disorders, cancer and oncology, and of course a big one would be mood disorders. So this literature review actually showed acupuncture to benefit over 90 conditions. So what does this mean for our horses? I'm going to talk a little bit here from direct experience because I think that is the most valuable. I've been practicing acupuncture for 23 years and specializing in horses for 21 years. So this is a little bit of what I've had success with and I've had direct work with. Of course, I've worked with all sorts of digestive disorders, including ulcers, gastric ulcers, hindgut ulcers, just horses not having a good appetite, not wanting to eat, refusing their food, or actually getting really anxious about their food, having diarrhea, constipation. And I approach digestive issues sort of multifaceted because I will work at it from an acupuncture perspective, but I will also work at it from a nutritional and a herbal focus as well. The other thing that I work with on a regular basis is just general energy and vitality, meaning horses that are failing to thrive. They're struggling with low energy. They have a poor hair coat and they act or look run down, meaning they're just not doing well. Of course, big on the list is all sorts of musculoskeletal disorders, including arthritis, muscle pain and injury, tendon and ligament injury, spine dysfunction, and pain. And that can be all the way from the tip of the nose to the poll, to the neck, to the back, to the SI area and the pelvis. As I've said before, acupuncture is regularly used to influence the myofascial system and the fascial lines. I find that regular acupuncture really helps the horse use their body better and stay sounder, no matter what you're dealing with. I approach this from a typical Chinese medicine perspective, but I also approach it from a myofascial, a trigger point, and a dry needling perspective. And of course, I've even had success with harder to treat conditions like recurrent airway obstruction, which used to be called COPD. Of course, neurologic disorders and even problems with proprioception, Lyme disease, which is a big one here in Maryland, and other chronic diseases. I've even had success with liver disease. Now, let's be honest, liver disease is not a good prognosis for horses. And of course, I am not claiming that acupuncture can cure it, but in the few horses that I've worked with, they have actually survived way longer than the vets expected. So we brought the horses some quality of life for the time that they had left. I've had the same outcomes with kidney disease. Of course, metabolic disease is a big one. And again, I approach this from several angles, not just acupuncture. Because the complexity of this disease and this diagnosis, it really takes a multifaceted approach. Another one that I've worked with a lot is laminitis from various reasons. Maybe it's metabolic, maybe it's feed related or grass related. And of course, I've worked with emotional issues of all sorts, from frustration to grief, but a lot around anxiety and of course, several from abuse. Before we actually get into how acupuncture does all of this, I want to talk a little bit about dry needling because there seems to be a lot of confusion around this topic. So, dry needling has been adopted as a Western clinical technique in physical therapy and sports medicine. But acupuncturists are trained in the same techniques. A lot of what we learned was what we called trigger point therapy, but it closely relates to what is taught now in dry needling. Any of us that have had any training in sports medicine have actually worked with dry needling. Chinese medicine has long-standing traditions of using very similar techniques to dry needling, especially in orthopedic and sports medicine acupuncture. And it completely overlaps with modern myofascial trigger points. Most acupuncturists actually consider this the easy work in comparison to working with more chronic conditions. And of course, acupuncturists employ techniques that look and work identically to dry needling, including insertion into muscle motor points, seeking the local twitch response, and using anatomical landmarks and muscle referrals. See how all this developed in the acupuncture world, it was historically used in martial arts. So it first developed in East Asian medicine because dry needling, or what they called needling ashi points, was especially important in the martial arts tradition for trauma recovery, muscle repair, and manual stimulation of muscle fibers and tendon regions. So this has been really well documented in classical Chinese medical text and in the lineage-based martial arts systems, which were sometimes oral traditions. but it's where fighters needed rapid recovery and restoration of physical function. So now we're just using that in modern medicine, but we're also using that with the horses. So it's very, very similar to Western modern medicine, quote unquote, dry needling. And acupuncturists that specialize in sports medicine have had a lot of experience using these techniques. You have to understand that licensed acupuncturists have around 2,000 hours or more of graduate level education to be able to do what they do in all sorts of Chinese medicine and East Asian medicine, but of course in acupuncture, where the physical therapist that's doing dry needling may only have 20 to 100 hours, and that's of continuing education. So I just wanted to point this out because there can be a lot of confusion. In the West, dry needling has become sort of this regulatory workaround for non-acupuncturists to use needles without claiming they're doing acupuncture. But this has led to the perception that dry needling is actually separate or new, when in fact it's not fundamentally different from certain forms of acupuncture. So don't think that it's something separate or something new or something that your acupuncturist can't offer you, whether that be your own acupuncturist or whether that be your horse's acupuncturist. And I just state all this because it's really important to recognize and respect the depth of training and the history behind what a lot of acupuncturists do, especially those trained in orthopedic and sports acupuncture if you're looking to have your horse treated for musculoskeletal problems and pain. Okay, I just wanted to make that clarification. So let's get back to the regularly scheduled program and what we were talking about. And we really want to look at now how acupuncture actually does all these things that we're saying it's doing. So it's great to say, oh yeah, I've had success with it with this particular condition. But where I really feel like the science is advancing acupuncture and Chinese medicine along is that now we actually know how acupuncture is affecting the body. So I'm going to go through a short list here, but then we're going to go back and look at these in depth. So we know that acupuncture can increase blood flow. It can reduce inflammation locally and systemically. It can reduce inflammatory markers. We know that it can affect the spine, the nerves, and the brain. We know it can regulate neurotransmitters and hormones. We know it can modulate the immune system, and we know it can reduce stress and affect cortisol and the HPA axis. So let's go into a little bit more detail on each of these effects because I think it will help you understand this even better. So first, let's look at how acupuncture increases blood flow. So acupuncture stimulates local nerves. So inserting a needle into the skin actually stimulates the sensory nerve endings, and that triggers the release of neuropeptides. These neuropeptides then cause vasodilation, which is the widening of the blood vessels, which increases local blood flow. So that's the first way that acupuncture increases blood flow. So what does this mean? This means more oxygen, more nutrients, and immune cells are delivered to the area, which obviously will help in tissue repair. The second way that acupuncture increases blood flow is through activation of the autonomic nervous system. So acupuncture can shift the balance between the sympathetic, which is the fight or flight, and the parasympathetic, which is the rest and digest branches of the autonomic nervous system. So acupuncture tends to decrease sympathetic activity, which normally causes vasoconstriction, which is the narrowing of the vessels. This leads to vasodilation and actually better circulation. So it's turning off the sympathetic nervous system, which leads to the vasodilation and the better circulation. The result of this is that it improves circulation, and oddly enough, not just at the needle site, but actually in other areas of the body as well. The third way that increases blood flow, and this is a big one, is it releases nitric oxide. So studies show that acupuncture increases the local production of nitric oxide. So this is especially relevant when we come to acupoints, where nitric oxide concentrations are actually naturally higher. What is nitric oxide? Nitric oxide is a small gas molecule that's produced naturally in the body, and it acts as a vasodilator. So it relaxes those blood vessels and increases blood flow, like we just talked about above. It's a neuromodulator, so it influences nerves, nerve transmission, and communication. And it's an immune modulator, so it helps regulate inflammation and immune activity. So when nitric oxide levels are high in the tissue, you can expect better circulation, enhanced signaling, and potentially faster healing. So we talked about that nitric oxide is actually in a larger concentration in acupoints. So that's part of what makes acupoints so special. Researchers have found that the acupuncture points differ from surrounding tissue. And this is new because when I went to school 20 years ago, this wasn't really very clear to us yet. So it's always fun every so many years to go back and look at the new research that is coming out, because there's actually a ton being done now. It's a really hot topic in research. And so it helps us figure out these things. And we didn't always know exactly why acupoints were so special. And now we know because they change the surrounding tissue by lowering electrical resistance. They have a higher electrical conductance. They have more blood vessels and nerve endings, and they have a greater interstitial fluid exchange than the surrounding tissue. So this is just specific to acupuncture points, and that is really cool. And of course, recent studies add to this by showing that acupoints also have that higher baseline level of nitric oxide. This nitric oxide matters at the acupuncture points because it increases blood flow. It relaxes smooth muscle in the vessel wall. It causes vasodilation, which causes more oxygen and nutrients to be delivered to the tissue. So this is crucial for healing injured tissue, flushing out metabolic waste, and reducing inflammation. The second way that nitric oxide really matters in acupuncture points is it enhances nerve communication. So nitric oxide acts as a signaling molecule in both the central and the peripheral nervous system. And it also can enhance the transmission of acupuncture signals from the needle site all the way to the brain, so to distal regions. Of course, the third way that nitric oxide is working in acupuncture points is it causes a greater response to stimulation. So the presence of nitric oxide may be one of the reasons that acupoints are more sensitive. And it could also partially explain the therapeutic effects you get when stimulating acupuncture points. So a lot of research, they'll stimulate an acupuncture point, and then they'll do this sham acupuncture where there'll be needling an area, but it won't be on an acupuncture point. And they've realized that, no, the acupuncture point makes a big difference. It's not just sticking a needle in the body, it's sticking a needle in an acupuncture point. And part of the reason of this effect are these things that I'm telling you about, but of course, this last one, which is the greater response to stimulation. So, okay, that was a lot. Let's get back to the fourth way that acupuncture increases blood flow. So we talked about 3 ways that acupuncture increases blood flow: by stimulation of the local nerves, by activation of the autonomic nervous system, by release of nitric oxide, and now we're to the fourth one, which is microcirculation enhancement. So acupuncture has been shown to improve microcirculation, which is the blood flow through the small vessels. Of course, better microcirculation means more efficient nutrient and oxygen delivery, and of course, waste removal at the cellular level. So, at the cellular level, we're even seeing that acupuncture can help with healing wounds, reducing inflammation, and relieving muscle tension. So, that's the 4 reasons under the category of how acupuncture increases blood flow. So let's go on to the next one that we talked about, which is how does acupuncture actually affect the immune system? So we had talked about acupuncture being able to modulate the immune system. And so one of the ways that acupuncture affects the immune system is it regulates inflammation. So acupuncture can reduce pro-inflammatory cytokines and increase anti-inflammatory cytokines. So it's like turning off the inflammation and turning on the anti-inflammation. And this whole pathway helps modulate chronic inflammation, of course, which is linked to many diseases. And so even when we look at conditions like arthritis or autoimmune disease, acupuncture has been shown to reduce inflammatory markers and relieve symptoms. The second way that acupuncture affects the immune system is it enhances immune cell activity. So, acupuncture boosts the activity and the number of certain immune cells. One of the immune cells that it boosts is the natural killer cells. So, that's part of the innate immune system that attacks viruses and tumors and bacteria and stuff like that. Of course, it also boosts the activity of the T cells and the B cells. So, that's part of the adaptive immune system responsible for targeted immune responses. And of course, it boosts macrophages and dendritic cells, which are important in detecting pathogens and activating other immune cells. So this shows how acupuncture can actually strengthen the overall immune function. The third way that acupuncture influences and works with the immune system is it actually balances the immune response. So we talked about if the immune response isn't working, how it activates all the immune cells. Now, what if the immune response is too much? What if there's an autoimmune condition going on? Or what if the immune response is so inflammatory right now? Well, acupuncture actually balances that too. So in autoimmune diseases where the immune system is actually attacking the body, acupuncture may help rebalance overactive immune responses because it can help regulate the T helper cell ratio, which is important in conditions like asthma, allergies, and immune disorders. But it can also regulate and influence regulatory T cells, which help prevent the immune system from overreacting. Okay. Moving on. This is a lot in here. I don't want to overwhelm you guys with all this information, but it is really interesting to see how much we know about how acupuncture influences the body. So the fourth way that acupuncture helps with the immune system is that it reduces stress. So this is sort of like an indirect immune support. Stress is known to suppress immune function, and acupuncture can actually reduce activity in that HPA axis, which is the hypothalamic pituitary adrenal axis, which controls stress hormones like cortisol. So lower cortisol equals less immune suppression because cortisol can actually suppress the immune system. So if acupuncture can come in and lower the cortisol, it can lessen that immune suppression. And of course, it improves vagal tone and parasympathetic activity. We talked about that earlier, which equals a better immune regulation. So the 4 ways that acupuncture affects the immune system is by regulating inflammation, enhancing immune cell activity, balancing the immune response, and reducing stress. Now let's go on to the next one. So now we're going to look at how acupuncture actually affects the brain. This is kind of short because I don't want to get too detailed and just totally overwhelm you, but acupuncture affects the brain by modulating pain pathways, by calming stress and emotional centers, by stimulating the feel-good brain chemicals, by promoting brain rewiring and healing, and by enhancing relaxation and mental clarity. So those are 5 big ones there. So we're going to understand this a little bit more as we go to the next category, because now we're going to talk about how acupuncture affects the sensory nerves. So when we get more into the nervous system, then we understand a little bit better how it's affecting farther along the nervous system chain, going from these little sensory nerves to bigger nerves to the spinal cord and then to the brain. So how acupuncture affects the sensory nerves. So acupuncture actually stimulates sensory nerves by mechanically activating nerve endings in the skin, muscles, and connective tissue at and around the needle insertion site, so at and around the acupuncture points. These nerves then send signals to the spinal cord and the brain, which leads to a wide range of physiological responses, including pain relief, muscle relaxation, changes in the blood flow, and of course, changes in immunity, which we've all talked about so far today. Let's break this down a little bit so we understand exactly how this happens. So the needles get inserted into the skin, they activate a receptor in the skin or the muscle, and then it stimulates mechanical receptors that are sensitive to things like touch, pressure, and stretch. And it stimulates nociceptors, which are pain receptors. The signal is then transmitted to the spinal cord and the brain. So these sensory signals travel through the periphery nerves to the spinal cord. And from there, their signals are relayed to the brainstem, the thalamus, and the cortex. So then this leads to a more central nervous system effect. So we went from the sensory nerves, now we're going to a central nervous system effect. So once the sensory nerves are stimulated, the brain and the spinal cord can actually respond and affect pain transmission via the gate control theory. You don't need to worry about that, but just understand that it can affect pain transmission. It can activate descending inhibitory pathways, and it can influence mood, stress, and immune responses through the hypothalamus and the limbic system. What does all this mean? Let's wrap this up because that's a lot to digest and a lot to think about. Acupuncture works by mechanically stimulating sensory nerves, which then engage the central nervous system to produce effects such as pain relief, reduced inflammation, calming the stress response, and improving blood flow. So basically, all of that was the fancy way of saying that last sentence. So that is the nuts and bolts of it. But I just wanted to give you an idea of how you can needle a point and how then that travels through the body and has these responses that we're talking about. So we mentioned that acupuncture also can affect neurotransmitters. So how does that actually happen? We know that acupuncture releases natural opioids like endorphins, and that can cause pain relief and relaxation and a sense of euphoria all on its own. We also know that acupuncture releases serotonin. So acupuncture increases serotonin in the central nervous system, especially in areas related to emotion and pain modulation. And this can help with mood stabilization, reduction in anxiety, better sleep, better appetite, and lowering of pain perception. Acupuncture may also help increase dopamine. So dopamine is the next neurotransmitter that it can affect. And this plays a key role in reward, motivation, and in motor function. So this can result in enhanced mood, enhanced motivation, and can be really relevant in horses for motor function, but in humans can be really relevant for addiction, depression, and things like Parkinson's disease. The fourth neurotransmitter that we know that acupuncture can affect is norepinephrine. and it regulates norepinephrine levels, especially under chronic stress or pain. So this can help reduce stress and improve attention and really deal with systems that are overwhelmed. The fifth neurotransmitter that acupuncture can enhance is GABA. And GABA is gamma aminobutyric acid. I think I pronounced that correctly. This helps in reducing anxiety, better sleep, and in helping relaxation. Okay, so that's wrapping up the neurotransmitters that acupuncture has an effect on. And now we're going to move on to how acupuncture affects the HPA axis. So we talked about the HPA axis, which is the hypothalamic, pituitary, adrenal axis. This is a large hormone part here. And so how exactly does acupuncture do that? Well, for one, it reduces corticotropin releasing hormone. We abbreviate that CRH. And adrenocorticotropic hormone, which is ACTH. So you guys are probably more familiar with ACTH. So acupuncture can actually downregulate the overreaction of the hypothalamus and the pituitary, which is caused by chronic stress. So basically, it's affecting the HPA axis because it's reducing these stress hormones. The studies have actually shown that with acupuncture, the CRH and the ACTH expression is reduced after an acupuncture treatment. So this lowers that stress response activation, which means less cortisol overproduction. When the horse gets stressed, cortisol goes way up. Acupuncture can help bring that back down. So it normalizes the cortisol levels. So that's really the second way that acupuncture affects the HPA axis, is it normalizes cortisol. So in horses or people with elevated cortisol due to chronic stress or anxiety, acupuncture reduces that baseline cortisol level. And the thing is, you notice we called it normalizing cortisol levels. It's just like when we talked about modulating the immune system. In underactive HPA axis states, so where you don't have enough cortisol, acupuncture can actually increase cortisol to normalize the levels. So this is really cool. Basically, we're sticking needles in the body, and it is giving the body what it needs to make this intelligent decision to help normalize the cortisol levels in the body depending on what the body needs. I think that is so amazing, because we're not going in and trying to take out cortisol and then end up with these side effects of, oh, well, we did too much, or we're not trying to go in there and actually increase cortisol. We're just trying to give the body the ability to modulate it itself. So the third way that actually acupuncture affects the HPA axis is it modulates the sympathetic nervous system. So we talked about this before, how it can turn off the sympathetic and turn on the parasympathetic. So it turns off the fight or flight and it turns on the rest and digest. So because the HPA axis is tightly linked with that sympathetic nervous system, acupuncture can actually inhibit excessive sympathetic activity and enhance the parasympathetic activity, which indirectly supports HPA axis regulation. What is this trying to say? That acupuncture can help with calming the body and the mind and in actually improving stress resilience. The fourth way that acupuncture works with the HPA axis is it actually reduces HPA axis-driven inflammation. So if the HPA axis is chronically activated, it can actually increase pro-inflammatory cytokines. We talked about that when we talked about inflammation. And acupuncture has actually shown to reduce those cytokines, suggesting that it helps break the cycle of stress-driven inflammation. So there can be this whole pathway where stress, poor diet, inflammation, overwork can really start messing with digestion, with inflammation, with the hormones, with the sympathetic nervous system, and get the body in this wired and tired state, which is both common in horses and in people. And acupuncture can really help balance the body, normalize all these activities, regulate these activities, and bring the body back into a balanced state of being. So acupuncture's ability to modulate, it doesn't suppress the HPA axis, it modulates it, makes it a powerful tool for treating stress-related and chronic conditions holistically. So that's what Hale and Hearty Horses is all about, which is the holistic treatment and the holistic perspective on health for our horses. So that is a lot. Wow. I know I gave you guys a huge amount of information in this podcast. And I love this stuff because this is even a good refresher for me to go back over the science of something I've been practicing for decades and see how it's developed. I absolutely love this medicine. And this talk really solidifies for me why. Of course, I've been using it and I know how it works and I see the effects on the horses, but I also see that this information isn't out there. That's why I'm doing this podcast, because people aren't talking about this, not unless you're in the research. And a lot of times I don't have time to go in depth and share this with my clients as I'm working on their horses. And so this podcast really hits home for me because it just gives people the knowledge behind what we're doing when we are working with their horses. So let me wrap this all up in this nice, neat package. So if like your head is swimming from all that information, I completely understand. And so I'm just going to wrap it up. You can always go back and listen to this again and take notes, but I'm going to wrap it up like this. Acupuncture works by stimulating specific points on the body. We call them acupuncture points or acupoints. We do that typically with fine needles, but also with e-stim and moxa. And this activates sensory nerves, it triggers biochemical responses, and it engages the brain, the nervous system, the musculoskeletal system, and the immune system. This stimulation leads to reduced inflammation, increased blood flow, reduced pain, modulated immune responses, improved digestion, increased energy and vitality, better organ function, and enhanced performance of the musculoskeletal and myofascial system in the horse. Giving acupuncture a top spot in therapies you should be including in your horse's holistic care. Okay, guys, that's all for today. Thank you so much again for joining me at Hale and Hearty Horses. Please like and follow, and please help me spread the word by sharing this and other podcasts that I've done with your friends, trainers, and fellow horse enthusiasts. This is Dr. Rebecca from Hale and Hearty Horses. I'll see you guys next time.